everybody. Dr. David Alter here. I want to welcome you to session 1 of IBS Relief Now. Let's dive right in and talk together about what in the world IBS is and also what IBS is not. As a syndrome, IBS is not reducible to a single cause. That's why a holistic approach makes so much more sense, because for certain people, some of the pathways into IBS are more relevant, others less so, but for a different person, a different set of pathways, a different set of variables needs to be paid attention to in order to be able to learn to control this condition. Over the next 8 weeks, we're going to get into these different pathways, sort of a different topic each week, as we identify what are the different things you can learn to pay attention to be able to put together a program with my guidance, with my support, that can begin to really work for you now and into the future. So IBS is not associated with identifiable damage to the tissues of the digestive tract. Unlike conditions like Crohn's disease or ulcerative colitis, or even in cases like stomach or colonic cancer, there's no evidence of that kind of tissue disease. That's what makes IBS a diagnosis by exclusion. When you have excluded the kind of conditions that I just mentioned, when you've excluded the signs of other bona fide disease, but you still have the symptoms of bloating, abdominal pain, gassiness, for some people tremendous problems with constipation, pain on trying to defecate, or for other people sometimes many different bouts of diarrhea in a single day. Sometimes that comes on very quickly, which is pretty frightening given that you may be out in public or a place where you don't have immediate access to a bathroom. You can alternate between constipation dominant or diarrhea dominant IBS, and then there are those folks who end up kind of oscillating back and forth between both of them. So those are the Rome criteria. A international conference of world-renowned experts in GI disease got together and identified that set of symptoms that show up a number of days a month over the course of at least 3 months. And when you have those conditions and don't have signs of other disease, by exclusion, you're often diagnosed with IBS. It's important to know that you are by no means alone with this condition. At least 50 million people in the United States alone meet the criteria for IBS. Around the world, the figure is many times higher. It is among the most common conditions for which people are seen in emergency rooms, or that they present to their primary care physicians with this set of symptoms. It's extremely common, and as we get into this course, you'll begin to understand why the gut is so easily the site where any of these different conditions or factors in your life can end up showing up in the symptoms and patterns that we call IBS. To appreciate the complexity of this condition and why a holistic approach makes so much sense, let me go through 5 of the factors that commonly are involved in creating this condition. One of the most common that I see is anxiety. Most of the people that I see with IBS clearly have heightened levels of anxiety. Does that mean it's really just an anxiety-based condition? Well, the evidence is no. Although having the condition is associated with anxiety, which certainly makes sense, if you can't trust your own body as you go out in public, as you go through your daily routine because you're not sure what's going to be acting up down below, that creates a sense of anxiety. But is it the chicken or the egg? Is it that anxiety leads to IBS, or that when you have IBS, you can become more anxious? Well, the reality is both are true, but it goes beyond that. Studies as recently as this year, 2017 or 2016, show that some of the microbiota, the bacteria that live inside our gut, are responsible for producing proteins that as they get into our bloodstream, they actually reprogram the brain to be more anxious. So even with that factor alone, we see that it's not an either-or simple solution. Our microbiome influences our brain to make us more anxious. When we're struggling to control the symptoms, we become anxious as a result of not having control over our gut. And people who tend to be more anxious are at higher risk for having greater amounts or greater difficulties with IBS. A second factor, what about genetics? Is IBS a genetic condition? Well, up to 37% of people with IBS have first-degree relatives who also have digestive problems, including IBS. So does that answer the issue? Not really. It's one of the factors, but it's not the ultimate cause. IBS is not primarily a genetic condition. Recent studies have found that there's an alteration in the sodium channel in the muscles of the digestive tract. People got excited about that. Maybe that's why there's this spasticity and discomfort in the colon. But when the research was looked at more closely, just over 2% of people with IBS have that genetic alteration in their sodium channel sensitivity. So with factor number 2, again, we see genetics can play a role, but it is not the explanation for what causes IBS for most people. A third factor that's important to look at is the idea of trauma, because up to 40% of people with IBS, especially among women, have histories of significant trauma in their childhood, during their growing up years, including emotional abuse, physical abuse, and unfortunately, sexual abuse. So again, we can say, is IBS a condition that is there because of trauma? No. Are people with IBS people who have a higher history of trauma? Absolutely. But what we're again seeing is that our early history can set us on a path that increases the reactivity and sensitivity of the digestive tract, but it is not the cause of IBS. It's one of the factors that has to be addressed if for that particular person there is a history of trauma in their background. How about a fourth factor? Diet itself. Maybe it's the foods we eat that cause IBS. Well, up to 11% of people with IBS do show gluten sensitivity, and eliminating gluten from the diet can make a significant difference. But is gluten sensitivity the cause? Well, again, for some people it's a significant factor, for others not that much at all. There has been some exciting progress made by following a diet that is low in FODMAP foods, F-O-D-M-A-P. It is a acronym that stands for a number of short-chain carbohydrates that are not well digested by our small intestine. They create irritation there, and as the food moves further south into the large intestine, the bacteria there have a field day, and they produce bloating and pain and gassiness, and they can directly affect the bowel habits that people that are sensitive to higher FODMAP diets. exhibit. So again, for some people, following a diet low in FODMAP foods can make a difference. Diet is clearly one of the factors that can influence the severity or the particular pattern of IBS, but is it the ultimate cause? Probably not. And finally, let's look at a fifth factor, which is the constellation of bacteria that live inside our gut. We could not survive without them. We absolutely depend on them. But depending on the composition of what's called the microbiome, we can either have bacterial citizens that help support good health, or they can be significant culprits in throwing off our health. In fact, there's amazing new research coming out showing that above and beyond the symptoms of IBS, if your microbiome is off, you can be at very much increased risk for depression, for anxiety problems, for cognitive clarity, thinking problems. It can produce problems with insomnia, attention problems, including certain types of attention deficit difficulties. The point is that there's yet another factor, another pathway in that for some people makes a major difference if you pay attention to learning how to cultivate a healthier microbiome. So, is IBS related to anxiety? Definitely. Is it the cause? No. Is it related to genetics? Yes, but again, not the cause. Is it a consequence of early trauma? For some people, that's a factor. Is it the ultimate cause? No. Can dietary changes help? Absolutely. Is an altered diet the sole cause? Again, no. And the fifth variable that we're looking at in this first session is the microbiota themselves, the bacteria that live inside our gut. Are they the sole cause? No. But attention to them, as I'll go over with you in a later session, can make a major difference in helping you learn to exercise control. One of the things that I'll be talking with you a lot over the course of these next few sessions is what are the tools that you can use to make a difference. One of the most overlooked and yet most powerful tools that you have with you all the time is your mind. How you can learn to use your mind in ways that can literally rewire your brain and change the reactivity of your body. We'll be doing that in a number of different ways that involves learning to pay attention to kind of what is operating in the background of your mind and what is operating in the background of your body, and then using what you discover to be able to make changes in it that quiets the mind, calms the body, improves digestion, and improves your outlook on your day and your future. You've probably heard the saying, seeing is believing. Well, in this course, one of the things we're going to be talking about is that perceiving is believing. What you sense, whether it's bloating developing in your gut, or a situation at work that makes you anxious, or a responsibility you have to take care of where you're not sure you'll be able to have ready access to a bathroom, you can begin to notice certain sensations, certain thoughts, and certain emotions that are then capable of activating the body and putting you on the path for intensified IBS symptoms. So regardless of what the paths into the condition might be for you, one of the things that we really want to help you learn how to do is to use your mind to begin to influence the activity level of those different paths, So as I said, you can quiet the mind, soothe the emotions, and powerfully quiet the body. Bloating diminishes, pain begins to subside, bowel urgency can begin to fade. Confidence and comfort in your body, trust in your body, can begin to increase. So let's take a look at what some of the tools are that can help you achieve those kind of dramatic changes, all to the good in our goal of giving you IBS relief now.